Okay, so feet and ankle examination. Most important thing is the history. Obviously, when the patient is coming into the consultation room, you look at the gait of the patient, how they're walking, either they're limping or whether they're weight bearing or not. That's the important thing. You look at the way you're coming in, you're looking at the both legs and their alignments as well, right? Then you take the important history as to where it's hurting, was there any injury, where exactly is the painful spot, after the injury were they able to weight bear straight away, did they needed any support. So you take the full thorough history to get a better picture. Any examination, you start with inspection. So first of all, the things that you look for is an obvious thing. There's any obvious swelling, like for example an ankle sprain, you might have some swelling on the lateral malleolus or medial malleolus or the lateral edges of the foot. Similarly, any other inflammatory condition, you might any specific areas where they are more swollen. Similarly, any signs of bruising and recent injuries. The other important thing is look for alignment of the foot. Okay, so any obvious congenital or acquired deformity, for example, deformities of the big toes. The most other important thing is to look for the arches, foot arch. So you look for whether they've got a nice foot arch or they're flat feet. Similarly, you look for the alignment of the ankle joint as well, whether they're inverted or exverted, halus or involgus deformities of the foot. Now, after doing a thorough inspection, you go into palpation. So we'll do the ankle and foot together, the palpation. Someone coming with ankle sprain, for example, the thing that you look for and palpate is the main bony spots. So like for example, the medial malleolus, you press them there, is there any tenderness? The lateral malleolus, another place which you check for any tenderness. The lateral edge of the foot, you check for any tenderness in that area. We're obviously looking at the patient face if there is any tenderness. Now, other things to palpate is along the margin of the ankle joint. We check for any tender spot in that area. Places like, for example, tenderness along the sinus tarsi, that area to look for. Lens flange flexures. You check the lateral edge, fifth metatarsal. Another important as well, like for example in the foot, you check for any tenderness along the heel or the plantar fascia where the attachment is. So those condition will give you a better picture if they're tendon, for example, over the plantar fascia. Achilles tendon is an important spot. Achilles tendonitis, any swelling, any of the tendon, any tenderness will give you an important clue towards that. So you do inspection, thorough palpation, and then you move on to the movements of joints. Foot and ankle movements we'll do it together. So for example, if I ask you to move your foot towards yourself, good. So we're doing the active movements. Put down, yeah, it was me, that's it. Move it inwards, good, and outwards, perfect. So there's a good range of movement in both feet. Obviously you're comparing the two sides. After initial movements, you do the resisted movements, which will give you a better clue of the joint and the power. So move your feet towards yourself, good, and then push against me, good, then move it inwards, good, and then outwards, good. And so doing the resisted movement. After that, there are some special tests that you could do. For example, the draw test. So you stabilize the joint and check for any laxity. Just relax your feet. And you can check for any laxity anteriorly. Similarly, comparing with the other side, if that is with the other side. Then lateral side of the tendon, the fibrous band, if there's any laxity in that side on the iliocanial, then the other side. Compare it on the other side as well. Completing the examination, you're checking for neurovascular deformity. You're checking the pulses in the both feet, yeah, side, Obviously asking him to touch sensation, checking for the touch sensation. And another important thing is checking the temperature, comparing on the other side, checking for looking for any redness and other signs of inflammation. So that is your foot examination. Okay, thank you very much.